Welcome back. This is Sleep Better TV. I'm Scott Drake. Back in studio, my guest, Dr. Mark Levy, DDS from Columbus, Ohio. And we are continuing our discussion today. This segment is on the TMJ. Dr. Levy, welcome back. What exactly is TMJ?
Well, TMJ is actually the name of the joint. It's the temporomandibular joint. And I find myself, sometimes I'll call it TMJ, which I really shouldn't because I should know better. It's temporomandibular dysfunction. You'll hear lots of people talk about TMD, but it's the same thing. It's a malfunctioning, basically, of the joint. There's a small disc between your jawbone and your skull, and that serves as a cushion between the two. And oftentimes that gets positioned incorrectly, becomes very painful, jaw clicks, jaw locks open, jaw locks closed. More often than not, the problem is based on the fact that the teeth don't come together right. I usually consider it, or I describe it as a war between the teeth, the muscles, and the joint. For some people, the muscles win and the teeth lose, whereas they start grinding their teeth and they end up with very short, stubby teeth. Sometimes the teeth win and the muscles lose, and that leads to migraine headaches, neck tension, shoulder problems, posture problems, believe it or not. It's all interrelated.
Now, how are teeth grinding or bruxism and TMJ related?
The question is, which comes first, the chicken or the egg? Yeah, it's all related. Tooth grinding, someone who grinds their teeth or clenches, they're doing damage somewhere, whether it's the teeth wearing down, the joint itself, or the muscles. The pain in the muscles comes from those muscles spasming. They're used improperly, they're activated improperly, and that leads to the headache. Headaches, about 85% of headaches are all muscle related, muscle spasming. So the key is getting those muscles relaxed.
And what are some of the common symptoms of TMJD, and how is it treated?
The most common symptoms are what patients perceive as migraine headaches. Whether they're here, feel like a vice or a clamp around their head here, the base of their skull, the top of their neck. More often than not, those are TMJ-related headaches, bite-related headaches. So the goal in whichever treatment, whatever way you go, is to get the bite balanced, right side and left side, front and back in the right relationship, or get the teeth position. This is always difficult to explain. More often than not, I see patients who have a deep overbite. That overbite causes those muscles to go into spasm. If you think about it this way, the lower jaw wants to be sort of down and relaxed and forward. If you have a deep overbite, the lower jaw, because of the lower front teeth, the lower jaw is trapped behind your upper teeth. And you start clenching and grinding, trying to get a release there. That gets these muscles, and top of your neck muscles very much inflamed and spasming. So the key is to get them where they want to be. And that can be done most often with a very specific type of orthotic. I call them orthotics because they're not night guards, they're not splints. If you think of them as a foot orthotic, a shoe orthotic, that's designed to balance out your gait, your stepping, it's the same thing. We've got to balance out your bite and get your jaw position where it'll keep those muscles most relaxed.
Dr. Levy, how long have you treated TMJD, and how long does the treatment process take?
I've been treating TMJ about 15 years. It's interesting that you asked me that. Most dental schools don't, other than touching on it lightly, they don't teach it because there's too much other stuff to learn in dental schools. The reality now is that 98% of dentists do not treat TMJ. I would not treat it at all until I found some equipment that allowed me to to measure things. If you don't have anything to measure the progress or measure the muscle activity, it's basically guesswork. So about 15 years ago, I found some equipment, and it's based on EMGs. Now, EMGs are, we all know what an EKG is. EMGs are the same type of thing for any other muscle. So I'm able to measure EMGs of your chewing muscles to determine where your jaw is most comfortable, where the muscles are most relaxed. And that's how we make the decision on the position for the orthotic. It's all computerized. We watch those EMGs, that muscle activity release and lower, and we record that position and we make the orthotic at that point.
Dr. Levy, thank you.
Thank you.
My guest once again, Dr. Mark Levy, DDS from Columbus, Ohio. This is Sleep Better TV.